too much. Just take a look at the maps. And we were to the slide then. We're to the slide showing the vision that we created. The short story of this vision, to cut to the chase, is that while we had a beautiful vision, we could not find comprehensive funding to fund the entire event. So what we did was break it into pieces. We started, next slide, keep going, with the first phase that happened in 2014, and we hosted an event for the College of Nursing faculty to say these are the exciting opportunities for research at Penn State. This was well accepted, it was a robust response, and it generated some excitement to actually get a project up and running. We then moved into the second phase where we trained research nurses across 9 of our campuses, which means these nurses with master's degree with primary clinical teaching responsibilities came to us. They completed city training. They did a number of other opportunities and training events to understand research processes to begin to prepare them for further engagement in research. In the third phase, we realized as community engaged researchers that there were some problems with IRB that needed to be addressed to facilitate our community partners working with us as co-researchers. To work as a co-researcher, these folks need IRB approval that they had training in the responsible conduct of research or in ethics training. Some of our partners in the College of Nursing actually had RAs with a community partner sitting by a computer and working their way through city. It was expensive, it was burdensome, and to create this relationship with a community partner in which you're saying, you are my equal, we share power, you are as expert as I am, and then start the relationship with city training that many found overwhelming, was not a very good start to a positive relationship. So we convened a task force. We had IRB representatives from Hershey and from UP. We had a number of different researchers, ethics representatives. We reviewed several products that were available through other CTSIs for community partners research ethics training. And we opted for a product called CPRET from the University of Pittsburgh. I want you to know that this has gone through both the Hershey and the University Park IRB. They have approved our recommendations. But then there were modifications and changes to the common rule, and their energies got diverted to paying attention to their primary bread and butter, the common rule changes that would affect the IRB. This has been piloted with Jen's work at Hershey, and we are now working with the University Park IRB to conduct a similar community partner training for one of my projects in January of next year. So know that if you're doing community engaged research, IRB need not be as onerous as you may think it will be. There's a product available, the pilot has been approved. I think we just need gentle nudges to say we're ready for uptake now and get it rolling. So that's happening. Putting all the pieces together, the next thing we wanted to do is actually engage with our communities. And so this project, the CBRN, Community-Based Research Network, was funded by PCORI. It's a 2-year project through the Eugene Washington Engagement Award mechanism. My partner on this is Nikki Hill, who is here with us today. It's a 2-year contract. And in this phase, we have 4 objectives, and I just put them up here to let you know where we're at. We have done more intensive training with nurses from across the state. We have 26 nurses at 9 different, Nikki's shaking her head, yes, 26 nurses at 9 different campuses across the state. This training was a little bit different. We've emphasized the CER, comparative effectiveness, other types of research, patient-centered research, and much greater depth on community engagement, how to form a coalition. We are doing group mentoring and individual mentoring. We've been doing that all through the summer and fall to get each one of these nurses engaged with their communities. We have 9 different specialty coalitions that are emerging across the state, including everything from dealing with the opioid epidemic to access to health care and many other topics in between. They're based on the nurses' specialties. So these nurses have now made contact with stakeholders in their community. They've identified key coalition members and are initiating community-based meetings to talk with these stakeholders to prioritize identified needs in the community. This is a really cool event coming up in early 2017, and that is objective number 3. We're going to be doing a training for our community partners. bring them in to give them the basic understanding of research processes so that they feel more comfortable in working with academic researchers, being able to verbalize, articulate their prioritized needs, and create a case for that research. All of this will continue. We'll be mentoring these small coalition groups, and then in fall of 2017 is our final event that recently has been named Research in Reverse or something to that effect. We're going to bring these community coalitions together and invite Penn State researchers to interface with them. What we have in mind is that these community coalitions will pitch their research ideas to us. And so that you as researcher may say, this is exactly the type of work that I'm doing, and engage with these communities. We have been reminded by the CTSI's External Advisory Board and others that the real proof of this concept will be in funded projects. And so we are really eager for a wide variety of Penn State researchers to join us at this fall event, to interact with our community coalitions, to really create some synergy and uptake among these community groups. This is the gist of this bi-directional flow. They come to us and say, here are our needs. How can you help us solve these needs? Not in the form of outreach, but in the form of research. So when we put this all together, it's been a little bit of a spiel. What does this mean to you? If you look at this map, these are the places where we have people in place to help you with your research. So perhaps somebody is interested in the opioid crisis and you're interested in obesity. That doesn't mean they don't know the community system and could make linkages for you and open doors for you. So as you think about the state and you think about regions or areas you'd like to really reach into a community, know that we have nurses there. Know that they are engaged and willing to help you enter their communities. And we really hope to see some uptake. I'm going to turn things over to Sheridan now that we're smooth as silk and it's just going to flow, Sheridan. And Sheridan's going to tell you about one of the projects that's going on at the College of Nursing that will begin to engage this network. Sheridan.
I'll switch. Okay, thank you. So I'm excited to tell you about the Safety Center. It is going to be led by the Department of Justice and the Office of Victims of Crime funded training or planning grant. So it's 15 months with the end result is that we're going to have 4 pilot sites that are engaged and ready to do telemedicine at the end of that 15 months. The work is being led by myself and Janice Penrod and Laura Dorn from the College of Nursing, but we have some really fantastic partnerships with the Clearinghouse for Military Family Readiness that is going to be doing part of the evaluation, along with a physician who has expertise in domestic violence from Hershey, which is Jen McCall-Hosenfeld. We've also engaged Casey McLean from Penn State Law. He's going to be doing part of a piece of our training, kind of this essential piece with nurses around becoming an expert witness, because it's a place where we often lose nurses because they're not trained in that way, and it's really daunting as part of what they do in this work that they would then be called to court. So I'm trying to come up with some dynamic ways of supporting nurses in this work long term. We also have community partners that are the nurses who are actually out in the state that are the experts and are doing this work on a regular basis, as well as Pennsylvania Coalition Against Rape. So thinking longer term about what kind of policy needs will we have and who's engaged in that work and who knows who we will need to be talking to. We have a great external advisory board that are Penn State researchers, because of course it's going to be important to think about what research do we need to do to generate a plan to say that this is cost effective, that the quality, there are improvements in health quality, so that we can really ultimately build a sustainability plan. And what's not here, but equally important, is that we will have a community advisory board. Those people just haven't been named yet. So it's really important that in this work we have an interdisciplinary response. So I would like to see that this will work best in communities where law enforcement, the district attorney, advocates, children and youth services are all at the table saying, we want to have expertise in our community around this problem, and that we really bring those people in as we think about expanding this as a statewide solution to help us understand how will we grow this responsibly and how will we do it in a way that matches with what a community is already doing.
Mm-hmm. I think it'll work. Yeah.
Okay, great. So there are 4 main parts. The first is kind of this creating a coalition of stakeholders that really want to develop our workforce in this area. So it's one of the reasons that I think Penn State is such an ideal place to do this, because we do have this beautiful distribution of our campuses. We have nursing in 12 of those campuses. And so it's a place where we can begin even with our own students and get them through nursing and thinking about being forensic nurses. And then that we will talk to communities about how do we support nurses to stay in the work, because nurses who do this are often also the ER nurse. And when a case does come in, it's quite disruptive. They get pulled from their regular work, but they're the person who's volunteered to say, I will get trained and I'd like to be the response of my community, but they do need to feel that the community values that work. So what work can we do to do that? The second is that we will have a 24/7 telemedicine response where we are pulling and getting a group of expert nurses across the state. So those that do the most cases and have the most experience can practice from wherever they are. They're not just Penn State nurses. And they will be the response and will actually work live. When a victim comes in, they can be there to help with the interview, they help with the exam, and I'll explain a little bit about what that looks like. So they can do that live with somebody, and it's really important that it be a mentoring process, that we are not just experts on one side and eyes and hands on the other, but instead that we are increasing the expertise of that local nurse so that they're building up skills and that they are the answer in their community. The third thing is that, and the most important, is that we will ultimately have 4 pilot sites where we will have MOUs. The grant pays for their equipment, so we will tailor equipment to meet the needs of their hospital. And the other thing that is built into the grant is we have a small stipend for a champion at their site, someone who will be communicating with us and ensuring that the project is successful. The final piece, and we will devise what this is, but probably a part of it being a partnership with World Campus, is that we are building a lab here that will be a simulation lab for forensics and sexual assault, and it will be a training room so that we can push out education on a quarterly basis to these sites based either on things that they say, gosh, we need to know more about this, or that as we're conducting exams, we determine that there's some just-in-time need or some knowledge gap that we might be able to fill by offering them some advanced topics. The other thing that the training center will do is to connect all of those pilot sites with the expert nurses and with us to have monthly meetings, because this is an emotionally burdensome area to work in, and most people in rural or underserved communities are doing this in isolation. And we know that the gold standard is that it's best done with our colleagues. So it's a place for them to bring cases, bring challenges, ask questions, and look for support. So on a monthly basis, they'll really be developing a peer network together. So this looks a lot like what Janice was talking about, but really was the best way for me to convince DOJ that this is really an ideal place. All of the blue are the areas that are rural. You're seeing the stars, that is our community-based research network. And I think that as we begin to build this and grow and really think about it as a state response, that would be a group that I would lean really heavily on to say, who are the champions in your community? Who do you already know that might help us figure out the community response? The 3 black, let me see if I can show you. These areas are 3 places that have already committed to or have demonstrated an interest and that we'll be evaluating as potential first sites. We're also talking to the Department of Corrections, because Department of Justice sees this as a great solution for Department of Corrections, and we're just working through. They have very different challenges there. So I'm hoping that we can potentially bridge that as a connection for corrections as well. So I think we are definitely poised to be a state that needs this. And I'm hearing that as I'm out in the community and talking to the nurses who do the work, that there is a great need. And I would also like to see that we can put this responsibly in places where down the road we can be a solution for children, because we don't have child advocacy centers in every county where we would like to see them. So I'm not showing you, this is a mannequin. I won't show you any pictures you don't want to see, I promise. But just to give you an idea of how it works, over on the left here, this is me talking to, I can be on and talk to a child. I can model how you might do a forensically defensible interview with a child or an adult to get the details of the case that will help guide where you might get your forensic evidence. So we do that in a lot of ways that it's sometimes difficult to ask open-ended questions. It seems like it would be easy. It's harder than it seems. So where I might be able to say, oh, wait, don't answer that just yet. And then I might be able to rephrase a question, and the person on the other side is learning how you might ask those questions in a sensitive way and in an open-ended way, so you're not leading a victim as well. With telemedicine, I can see exactly what she's seeing behind the colposcope. So it's essentially a microscope on wheels, allows us to see very tiny anatomy. So I can see the difference between a blood vessel or a submucosal hemorrhage, which is a tiny little bruise that might be the only evidence of an injury. So really important and very difficult, technically difficult to get those images. So I can help guide someone through this by saying, oh, you might want to adjust the way that you're positioned, or adjust the way the patient's positioned, or if you could move the camera a little closer, then I can ensure that they've gotten the right image, and that helps in prosecution as well. This final picture over here on the right is that we have previously at UC Davis, when we'd done this work with children and adolescents, would send our mannequins to the site so that they could practice with the equipment that we'd given them. They could do it with a mannequin, and I might stay at UC Davis while we sent an examiner to be with them and give them an opportunity to see that I'm there to be their partner, that we're going to talk, this is the way we would talk about the case even in front of a patient. And what I think is surprising is that people who even were concerned that they might look like they didn't know what they were doing, that's not the experience. So we set it up as saying, this is our partner at Penn State. And when we did evaluations to find out what parents or victims thought of this, they actually rated their rural provider very high in satisfaction ratings for having access to telemedicine. They felt like they went this distance to get us this specialty service. So that was a great benefit. We also had the examiners tell us, gosh, I felt so much more supported. I felt like I wasn't doing it alone. When the exam was done, we would get off of telemedicine, talk to each other once the patient had left, and talk through the diagnosis to make sure that that they were seeing what we had seen. So the final piece, and the piece that I'm excited about having a board that will help me think through some of the, how will we demonstrate cost effectiveness? How will we build a plan that will be sustainable? Because there's never enough money in victim services at all. So these hospitals are already losing money. When we layer on telemedicine, we need to be really thoughtful about how will we demonstrate the utility. And part of that is trying to determine, will it improve quality? So something we had done at UC Davis was we looked at the hospitals where we had delivered the service through telemedicine and compared it to rural hospitals that conducted sexual assault exams but did not have telemedicine. We took all of the images, all of the paperwork, all of the diagnoses, sent it to an outside expert who reviewed all of it for quality. And we did find that it was there were significant improvements in all of the areas of quality that we would have expected. So that was part of why DOJ said, let's see if this could also be a solution for adults and adolescents. And I think that's where the really exciting kind of research part will come in. But I know all of you are already out there doing work in communities, so I am happy to have any input and help along the way, or your thoughts about how best we can grow this solution.
Great.
Do you want to do questions for them? Or?
No, Sarah, are we taking questions now, if there are any?
Let's wait till the end, just to make sure we get through Keith's presentation. And then
You guys are muted.
Dee, can you hear me?
Yes?
Yeah.
Okay, let's wait till the end for questions so we can get through Keith's presentation.
Watch the cord.
Okay. Oh, Sheridan,
yeah,
do you mind if I
you
just
can
grab
help
them?
Okay, I think
Okay,
it's
so we're just going to do this.
Yeah, the video.
So thanks, Cynthia and your team, for inviting the Clearinghouse to make a presentation. I'm going to be talking about probably a 7 to 8 year journey in the next few minutes. So I'm going to hit primarily on some of the major lessons learned, I guess we can say. So it was about somewhere in 2007, 2008, our cooperative extension system, which at the time was much more robust than it is now. Unfortunately, it's been downsized dramatically. They encountered in their work numerous military families. Pennsylvania, although we don't have a military base, contributes some of the largest numbers of folks in the National Guard and Reserve. I think we're the fourth largest behind California, Texas. So there's quite a few active duty and veteran folks who live in Pennsylvania. At any rate, they had been hearing firsthand about a number of the struggles that were occurring in military families throughout the state, largely because of the up-tempo that was associated with two major military operations, one of course in Iraq and one in Afghanistan. So as that feedback got up to us here at main campus, the Social Science Research Institute and the Office of the Vice President for Research at the time said, you know what, we have a lot of expertise in child, youth, and family issues, but we're not addressing it toward this particular group of people. So Susan McHale and Office of the Vice President for Research put up some funds so we could start thinking about ways to coalesce our research expertise and think about how it might be applied to the military. So we got a bunch of folks together to start discussing, hey, this is a new initiative. We want to start moving in this direction. We invited as many people as we thought who might be interested. And what we found was a little scary. Very, very few faculty had any experience in working with military. And frankly, I would say those that did not speak enthusiastically about it. They felt that there was a lot of oversight, there was a lot of reporting that needed to be done back to the military. So we were, starting this initiative not having a very good feel at all. The bottom line is, we learned very early that we just didn't know the lay of the land at all. So learning to crawl. So in this very beginning stage, we identified all the faculty we could who had any experience working with military. We continued to talk with cooperative extension and outreach folks to learn more about what they were hearing. And then our first sort of connection to the military directly is we reached out to our Pennsylvania National Guard, who the Adjutant General at the time was a Penn State alum. So we reached out to her. She was gracious and got us in touch with some of her underlings. And we just started to talk to people who were connected to the National Guard. They arranged, it was not easy, they arranged for us to start meeting with some families. We did some focus group work. We digested as much of the literature as we could, what was already known about military families. There were other universities that were actually doing some good work and had made some good community connections. So we learned about what they were doing as well. So we were just trying to fill our brains with what is happening in this context. So here were the earliest lessons learned, and as you can say, they are a little bit scary, and there were times when we were thinking, are we really ever going to be able to do this? We didn't know anything. There were a lot of problems occurring in military families. So it was really clear to us that if we were going to do this, we had to be patient. People were not going to come running to us for us to share our wisdom with them. We had to sit and we had to learn and we had to listen. And that's what we did a lot of. And I would say certainly there was a lot of distrust when we went to the National Guard. They said, we can't tell you how many researchers come here wanting access to our families. And we were like, we're not coming to get access to your families. We want to learn about the issues. But there was a lot of skepticism when we first started to meet with them. And interestingly, I'm going to talk about some successes, but the National Guard, who were very helpful to the Pennsylvania National Guard, who were very helpful to us in the beginning, we've not done any work with them, interestingly enough, but they were very helpful. So, and we also figured this was going to happen with lots of fits and starts. Because we had so much to learn, we knew we were going to make mistakes. And we knew we had to fill our buckets of information before we could be good partners. So we were starting to, we were doing that. We were starting to fund a few small projects from the infusion, little bit of infusion of money we got from the SSRI and the OVPR. And out of the blue one day, I'm working in the office and I get a call. It's from someone who's at the Department of Defense. I said she worked at the Pentagon. I almost dropped the phone. I was like, what is this about? And she had heard, and I mean, to this day, I'm not entirely clear on how she heard, but she had heard that, hey, Penn State was up to something. What are you guys doing with military families? And I gave her a quick explanation of what we were trying to do. And she said, you know what, I'd like you to come down to DC and tell us more about what's going on. So Susan, it's been so many years ago, I can't even remember who went, but Susan, myself, and a few other folks who were really are very knowledgeable people around children, youth, and family issues. We went down. And I would say the way we framed our discussion, and I think this was really important, and I think it resonated with her. We started with the land-grant mission. We said our university is a land-grant institution. The land-grant mission is to do work that is relevant to our populations, state, local, national. We talked about resources we had. We said, look, these are capabilities. We're trying to learn the context, but we still don't know it well. So we said, if we can be of help, let us know. We didn't push. We just wanted them to get a feel for, hey, this is what Penn State can do. So I think it's really important. I guess a lesson learned was to really put the land grant mission way in the beginning, rather than talking about our own research interests or our own research needs, because I do think it resonated with her at the time. So after this conversation, when we go down to DC, then at some point she got in touch and just asked if we could write a little concept paper about connecting cooperative extension to military families. So we did that. And frankly, I think what that was actually an RFP disguised as a concept paper. So after some back and forth, they said to us, hey, we're thinking about going in this direction sort of based on your white paper. And it was to set up a repository of information. This is sort of where it all started. A repository of information around evidence-based programs and practices that could be used with children, youth, and families in the military. Because what they were very honest about saying in the beginning is that they had funded a lot of children, youth, and family programming that had no evidence behind it at all. So our first project, it was a large project, and it was generously funded, was a complete outreach and service project. It was to build this repository of information. That's why we're called the Clearinghouse, and we're doing a lot of different things, but a clearinghouse is a repository of information that's been vetted. So we did that, and then we said to them, well, why don't we have some live technical assistance? Because if it's just a website and people are looking for information, there's going to be no engagement. We won't learn about what people are dealing with across the country and frankly across the globe, because our military is stationed all over the world. So we also offered then some technical assistance so people could ask us questions about, what would be the right program? We're dealing with this over here at this base. So we were learning about them, and they were learning more about these programs and practices. So again, first project, no research at all, outreach and service project. So the next big event, and I think what's good about having Janice talk about the way they did it, if you remember, she talked about phase 1 and phase 2 and phase 3. I mean, it was so well thought out and conceived. And I think ours is a little bit more serendipitous because a program manager at the Air Force Medical Operations Agency had heard about the Clearinghouse and this repository of information about evidence-based practices. One day she got on our website and she was looking around for brief interventions, evidence-based interventions around alcohol abuse. We did a rapid review of the literature for her. We sent it to her. I guess she was impressed with the quality and the rapidity with which we had done this for her. And then she asked us, hey, I think we have a project that you guys could help us with. And she asked us to go down and evaluate a brief evidence-based intervention that they were doing, alcohol brief counseling. So we did. It was not being implemented well. We redid the curriculum for them. We trained up their people who were doing it virtually because they were a problem. I'm kind of skipping around a little bit, I realize. But training is a real problem for them. They hire a lot of people. They are running around like mad. And in this program, which actually is a good program, and there's good stuff behind it, it wasn't being implemented with quality. And Penn State is very strong at implementation and evaluation research. We were like, we can help you with this. So it was a great opportunity, but we had to learn a lot about what they were doing before we were in that position. So some more lessons learned. You heard the original ones. The original ones were like, oh my God, why are we even doing this? We're never going to get anywhere. But it was very clear that we had to address, and Janice got at this as well, we really had to say, what do our partners want? What are they interested in? What are their questions? What are their real world problems? What is it that we can help them with if we're even in a position to help them? So our research interests really had to take a back seat. And I'm not saying they're ignored, and we can talk about that more later, but they had to take a back seat. That we were an applied research organization that was about helping them address their issues. We've always offered support and help and input. We've always tried as much as we can to execute quickly. If you think about the military, they're used to like giving out orders and people execute. And so we've worked hard on executing with quality and doing it quickly. I can't think of a time we've made an ask for money or you should fund us to do this. It has always evolved much more organically. And again, it's evolved around answering questions that they have or needs that they have. And then actually negotiating a little bit about, hey, this is great and we'll do that, but there's a really interesting research question here that we think we could inform children, youth, and families research, not only in the military, but also in the civilian world. And building trust absolutely was critical to this. I think I skipped over a point earlier on that they were very skeptical. And I think they were particularly skeptical of working with a university because they think of universities as a bastion of liberalism and not military friendly. And so they had done a lot of work. Who they were doing work with prior to land-grant universities were what we call Beltway bandits. They would hire a lot of consultants in and around DC and the Pentagon who aren't the best scientists. But building trust is still going on. It takes time, but I think we're much further along. Word of mouth has spread. Now we are asked to do a lot of work. But all of this has also been built on these Penn State strengths, which we all know very well. And increasingly, when we have time to sit back and think strategically, we are trying to organize to be even more deeply engaged. It kind of hurts us that we're not engaged very much with Pennsylvania yet, but we'd like to. So we're trying to engage, to organize for engagement with learning, design, communication, implementation and dissemination of useful information, and the like. So it's working. I mean, it's taken some time and it has had fits and starts. It's been a 7 to 8 year process. The first 5 years has been about doing the work that they wanted us to do. And I think we're finally now at a place where we have data from projects we've been working on. We're starting to get publications going. We're increasingly integrating students into the work we're doing. Our staff has grown substantially. We're about 61 employees, about 20 of whom are doctoral level researchers. We have a number of master's level researchers. And we've really worked to get a tremendous amount of funding, which has been fantastic. But I think it's been successful because it's always been about answering their questions and helping them with their problems. So through these fits and starts, and it's been hobnob and it's been crazy and hectic, I do want to show you that we have gotten a little more organized and a little more sophisticated. So I very quickly want to show you a film we did. We were nominated for a national award for Engaged Scholarship. We had won an award at Penn State. We then won, and this is by the Kellogg Foundation, we won a Northeastern Award for the work the Clearinghouse was doing to connect to the military community. And we went up for a national award we didn't get, but we were asked to make a brief video. So I just wanted to show that real quick, if we can figure it out. If we get back to box.
Yeah.
Where's that here?
Sure. Try that. Or right there, actually. Go right there. You're in box.
Okay.
Sorry, you were in box right there.
Here?
Yeah.
Sorry, guys. Do you want to ask questions while we're figuring this out? Okay. Go back. All right. And one sec. All right. Here we go. Just want to show this real quick. Because it has some of our partners in here, which is why I wanted to show it. So hopefully the volume will be, I'm going to put the volume up.
Can we hear anything?
Oh, hang on. It's just music right now, I think so.
I think the Clearinghouse from its very beginning was established as an organization that is really embedded within the military communities. From our leadership throughout our entire community, supporting the military is a key priority in Penn State. The Clearinghouse for Military Family Readiness plays an important role in providing evidence-based interventions that really take the application of what we know from research to help these individuals.
The crux of that relationship with the Clearinghouse is to make that connection and to help us translate these really important research findings, but then to make it something that we can use with families and with people who are struggling, with people who are wounded with PTSD or sexual assault victims.
That's what makes them unique, is their investment in our actual students and really having that understanding that in order to retain the soldier, you really must retain the family.
Penn State University has taken my expertise and used it to develop curriculum. Our partnership is hand in hand in everything we do.
And as part of that, what we feel one of our major goals is to train the next generation of scholars and to really have them engage in the work that needs to be done.
I'm Mallory Hamilton, and I've worked at the Clearinghouse for about 5 years in various roles. So as an undergrad, throughout grad school, by working with the Clearinghouse, you have the opportunity to pair with mentors to kind of gain a whole variety of new skills.
I believe this partnership, true partnership, is a real model for how a university and the U.S. military should interact and serve the U.S. military and their families.
Okay.
Okay.
Good.
So we guess at this time we're open for any questions, comments. Perhaps before we do that, I just want to share, if you're new to community engagement and kind of making your way, there is a book that's available, and it's called Principles of Community Engagement. If you Google that, it'll come up with a CDC reference. And just look for Principles of Community Engagement, and you can download a PDF of this book. It's really well written. It goes from philosophical and high-level perspectives of what is a community through different strategies for engaging community. If you buy a hard copy, it's like $17.50 or so, but you can download the PDF, and it's a nice reference. It's a very good starting point for those of you new to the area. Are there any questions or comments?
This is Cynthia. I have a question for Keith. I think it was really interesting and important what you said about how the outreach and engagement process and the trust building process can take a really long time, which can be hard for university researchers to understand when we're trying to get a grant application written and it's due, next month. So I'm curious, I know you described a little bit about how you went about that. And I'm curious if you or Sheridan or Janice can share, how do you, what are some of the service projects that you guys did, or what exactly are some of the things that might be in your toolbox to start, showing that you want to engage in that trust building process? Because I don't think that's something we are good at or know how to do right away.
I think for us, we were in some ways forced into acknowledging our own incredible limitations around the context and the culture. We knew the context and culture were really important. And so I think that sort of helped us be patient. We thought we could contribute in this area based on Penn State's strengths and needs that we were learning about around military families, around implementation science, around evidence-based practice. But so we knew that there was some potential payoff down the road. But we knew we really needed to learn the culture and the context. It didn't matter that we know a lot about how do you get communities to uptake new programs. It doesn't matter if the community doesn't care about you or doesn't trust you or doesn't know you. So I think there was some patience. It was also incredibly helpful. The university did put some money behind this to start, and so we were able to reach out to faculty who we thought were particularly doing work that was particularly related, so that was helpful as well. The clearinghouse, though, I think has been an incredible jumping off point. It was okay for us that it was a service and outreach project because we thought all along that it would get us in a position to know communities better. So I don't know that I have anything fantastic to say about that other than if you are a researcher who is in a position where you can take a little bit of time to position yourself, it absolutely can pay off. But I guess you can't rush it, and you have to also have the confidence and faith that you do have something of value. It's more a question of how do we bring the thing that's of value to the community in a way that will make sense to them or that they care about or can make a difference from them. And I know it's hard to do. There's no question. There are times when we were like, we're not doing any of the work we want to do. But I think keeping the thought always in the back of our mind that at some point we'll get there.
I have an example that it was kind of a fast track. I had an R01 funded that was demonstrating the utility of participatory action research to translate best practices in end-of-life care into the context of prisons. We were actually funded for 1 full year of an environmental scan in which we spent time inside the prisons, getting to know the people and engaging our community partners. I don't know how often that will fly, but it worked. And we've subsequently been working with that group of stakeholders since then. But I'd like to highlight that the CBRN has been developed as a way for you to gain more rapid access to people in communities. So if you know you need specialists in a small community, in a geographic community who are providing care to those with X or interested in Y, our nurses are geared up to say, here are the right people to talk to and help facilitate that kind of a process. Because we know and recognize that this is a relationship. All of this is relationship-based, and the relationship has to be established. We're hoping the CBRN network can jumpstart relationship building and help you gain access, but it still does take time. And what I've learned, and I think my partners have learned in this endeavor, is that it's not all funded effort. You spend a lot of time, sweat, and energy attending meetings, going to dinners, doing guest speakers, whatever you can do work your way into that community and get to know faces and press the flesh kind of thing. I mean, you just have to be known. When we use that type of an engagement, one of the things that we really capitalize on is that we don't go in as Janice Penrod, the expert, with all my letters behind my name from Penn State, call me Dr. So-and-so. We go in as, hi, I'm Janice. What do you know? Here's what I know. How can we work together? And I think those little strategies of trying to create equality and co-ownership right from day one is critically important to building relationships.
And I think maybe in our case, we felt very like we're so stupid about this. We really don't know. Like we were like, we can't go anywhere without them. It wasn't even equal in our mind because again, for us, because without the culture, we knew what we had. Without knowing the culture, we knew what we had was useless. So, and just very quick, because I want to make sure I get this in, and that is, so with respect to building connections with the CTSI and the clearinghouse, we are absolutely interested in doing that. One thing I do want to say is that the public health problems that are facing the civilian world are all happening in the military world. Overweight, obesity, family violence, alcohol, tobacco, and other substance abuse. I mean, these are all public health concerns that are impacting them in amazing ways. They've had to lower their standards for physical fitness, just as an example. Something they're not really happy about. But so these are the kinds of issues that the CTSI is interested in. These are all replicated in the military. And also just to say one other thing, as Janice did, and that is, we're in a position now where we can get the entree a little bit more. We're happy to bring people to meet the people that we know. So there's that sense of, maybe we can speed things up, maybe we can't, but we're certainly willing to try. So I just want the community engagement folks to know that we're certainly in a position to start doing some of that.
I can just add one thing from the understanding the short turnaround. So the telemedicine grant, I was writing in a very short period of time, and coming from California, where I knew that system, I had to start with, who are the expert nurses here? Because we aren't going to be the clinical response. So who are they? And getting to know them and asking them, what did they see were the issues? And then being able to say, gosh, I think that this could be a solution that we can create together. So I think the other message is that all throughout, this isn't my grant, it's not our grant at Penn State, but it is, I keep going back to them saying, like, we were successful. They weren't writing the grant, we'll do that piece, but that they have this ownership in this project and that we will grow it together, and the answers will be coming from them. I'm going to tap into them to do the training. It won't be me and our experts that do the training, but they will be part of that. So I think building in that ownership in every place that we can, that this is the solution that they want to see, and that they are as an equal partner in the work is really important, so that they will carry it forward.
So all three of us are kind of, if you think of community engagement. I'm sorry.
Great.
If
There's a
you,
question on that.
I have a question here.
Hi, Janice. It's Jody from Penn State Hershey. I had a question about, you had mentioned, I think it was one of your third objectives was to have a training in early 2017 for community partners. You could speak a little bit about that, and who is that open to? Anything you could tell me would be fantastic.
Sure, great. What we're planning on doing is bringing partners involved in our coalitions that are forming with our research nurses across the state in. Right now we're developing the curriculum. There are several models for this type of training available through other CTSIs. We're looking at other model training. The primary objectives of this training, we'll get to work through the process of research, the language of research, and how to frame needs into researchable projects. Curriculum's under development now. We definitely have funding through our grant for the community partners involved in our project. We're hoping to expand that the opportunity to other community partners across the university. And we'll be in touch through the CTSI announcements to let you know how broadly we can open that conference. But we do hope to open it to others as well.
Thank you.
Other questions?
Not from up here, I don't think.
So during this brief, if I can just add, we've all talked about community engagement. If you think of community engagement as a continuum, going into a geographic area to really research and examine unique characteristics of a community, to the other end of CVPR or participatory action research, in which there is co-research. The partners are involved in designing the study, in implementing the study, and interpreting the results. When we talk about co-ownership, we're pretty much on the far right-hand side of CBPR or PAR research. Community engagement can happen the whole way across this continuum, though. So don't feel as if you need to go to a full CBPR approach in order to have community engaged research. It's a style of, a type of. If you're on the other end of the continuum, there are still important considerations, community advisory boards to help you think about proper interpretation, and if nothing else, when you disseminate your results, you should think about your professional publications, but also think about communicating to the research partners, the subjects or participants, and also to the community at large. So newspapers, TV spots, however you can get back to the community. At a minimum, that's what we owe communities when we do research in their area. Thanks, Cynthia. I had to get that in.
And I'll also actually add to remind everyone, CTSI's engaged research core and one of the things that we do is invite researchers who want to do community engagement as part of their work, and we can offer a consultation to them to help them through the process regarding community engagement. So to keep that in mind as well. So I would love to thank our speakers. So Janice, Sheridan, and Keith, thank you so much for sharing your experiences with your wonderful students.
Thanks, Cynthia.
I do have a question.